Good morning. My name is Shannon. I'm a student nurse practitioner and I'll be performing your exam today.
Good morning.
Prior to entering the room, I reviewed her chart. She is a 55-year-old female. She has no known allergies. Her vital signs, her temperature is 98.0, blood pressure 128/68 on the right arm sitting, 126/62 on the left arm sitting. Heart rate is 65, regular rate and rhythm. An EKG was done prior to entering the room. Heart rate 14, O2 set 100% on room air. She has 3 out of 10 pain in her head and neck. She's 5'3", 170 pounds, and orthostatic blood pressures were negative. They were done by the MA prior to me entering the room. What brings you into the office today?
Well, I had an episode yesterday afternoon. I guess I passed out. My husband got nervous and wanted me to get checked out.
Okay. Has this ever happened to you before? Can you tell me about what happened?
No, this has never happened before. I was sitting on the couch with my husband and I felt funny. It's hard to explain. I felt almost like I had deja vu. Then I started to get really nauseous. I told my husband I was going to be sick. The next thing I remember, I was lying on the couch and with him leaning over me calling my name. First I heard him, then I opened my eyes and I could move and talk to him.
Okay. What happened after you passed out?
Nothing. I drank some water and I felt fine.
Okay. May I ask your husband to describe what he saw?
Yes, of course.
Okay.
Jimmy, tell her what happened.
Jimmy's filming the video, so he's going to read what happened.
Well, honestly, it was really scary. She was mumbling something and then was like staring off into space, not responding to me when I was trying to talk to her. Then she leaned over to the side and it felt like her whole body was, kind of stiff. This happened for at least a minute, maybe two. It felt like it was forever, though. I was calling her name, and finally she did answer me. I sat her up, and I gave her some water, and then she seemed fine. She had toast for dinner, and that was about it. I wanted her to go to the hospital, but of course she was reluctant.
Okay, thank you. Okay, what had you done earlier that day prior to passing out?
Nothing out of the ordinary. I've been laying low since my injury.
Oh, okay. What injury are you referring to?
Well, Jimmy and I went mountain biking on a really hard trail about 5 days ago. My bike got out of control. I fell off. I hit a tree. It was pretty bad. I had to go to the hospital. I got a CT scan and they said it was fine, sent me home with a bad concussion. I've been getting headaches and sore muscles since, so I haven't been doing too much.
Oh, okay. It seems like you've been through a lot this past week. Did you have a helmet on when you hit the tree and you had your bike injury?
Yes, I did have a helmet on, and it's been a long week.
Okay. When you passed out yesterday, were you incontinent of urine or stool?
No.
Okay. Do you get any chest pain, shortness of breath? Do you get dizzy or lightheaded?
No, none of those.
Okay. How about trouble with your vision, blurry vision, seeing spots? Trouble with your hearing? Any weakness in your extremities?
No.
Okay. Fever, chills, nausea, vomiting, diarrhea?
No.
Okay. You said you've been having headaches. How about confusion? Have you been feeling confused or disoriented? Have you been having hallucinations, feeling depressed, sad, anxious, shaking, numbness, tingling, anything like that?
Well, I have had a little headache and some neck soreness, and I feel tired overall. I do have a history of anxiety, but nothing more than normal, and none of those other symptoms.
Okay. What other past medical history do you have?
Anxiety, hypothyroid, carpal tunnel in my right wrist. I had surgery to get that fixed about 5 years ago, and plantar fasciitis in my left foot.
Okay. Do you still get your period?
No, I do not.
Okay. And when was the last time you had it?
About a year ago.
Okay. How about family medical history? Anybody in your family have any medical problems?
My father had diabetes, he had high blood pressure, he did die of a heart attack. My mother is 95 and is healthy as a horse.
Okay. And what medications, or if any, do you take on a daily basis?
Baby aspirin, Synthroid, multivitamins, calcium, vitamin D, and I do take 10 milligrams of Lexapro daily.
Okay. So a couple funny questions. Can you tell me what today's date is?
It is September 17th.
Okay. And where are we right now?
We're in a physician's office in North Haven.
Okay. And who is the president?
President Obama.
Okay, very good. Is there anything else you want to share with me before I start your exam?
No, I don't think so.
Okay. Then have you take off your glasses.
Okay.
I'll put that over here.
Okay.
Okay. I'm just going to inspect your head and neck. I know that you said your neck is sore, so let me know if you have any pain. Any pain?
No.
Okay. I see you have a little bump here. Is this where you
That's
your
where I
head?
hit the tree.
Okay. I'm gonna do some tests to test your cranial nerves. I know some of it sounds kind of funny, but we'll go through it as quickly as we can.
Okay.
So I'm gonna have you close your eyes, occlude one nostril, and I want you to smell this and tell me what it is.
It smells like cinnamon.
Very good. And I'm going to take a look in your eyes. I don't have a fundoscope, so I'm just going to pretend and look in your eyes. And the lights will be off during this part of the exam, but for the purpose of the video, we'll keep the lights on. So your eye exam is normal. You have no AV nicking, no abnormalities. Your optic disc is intact. Same thing on this side. Okay. I'm going to look at your pupils. Okay. I'm going to look at the size, their shape. You can just look right at my nose. I'm going to look at their size and shape. They're equal, round, reactive to light, about 3 millimeters, and with consensual reaction. So I'm going to have you follow my finger with just your eyes, okay? I'm going to move my finger, just follow me. Very good. Great. Perfect. And that's just looking at your extraocular movement, which is normal. Excellent. Very good. I'm going to have you do a couple more things.
Okay.
I want you to close your eyes really tight. Don't let me open them. Good. And smile for me. Good. Frown. Good. Stick out your tongue. Good. Puff out your cheeks. Great. I'm going to put my hands on your shoulders. I want you to push up against my hands. Good. Good. Normal strength there. Did that hurt your neck at all?
No.
Okay, good. I'm just going to take a look in your mouth. I'm going to have you open your mouth, stick out your tongue and say ah. Good. Ah. Good. Good. Your palate moves normally. Let's test the strength in your jaw. Can you clench your teeth? Good. And move your jaw from side to side. Great. Very good. I'm going to do a couple more things. I'm going to test some hearing.
Okay.
So first thing I'm going to do is I'm going to have you occlude your right ear. I want you to repeat what I whisper in your ear, okay?
Apple.
Good.
Baseball.
Excellent. We're going to do the same thing on the other side.
Orange. Football.
Excellent. I'm going to strike the tuning fork, and I'm going to put this on the top of your head. I want you to tell me if you hear it or feel the vibration.
I do.
Equally on both sides?
I do.
And I'm going to do another test to test your hearing. I'm going to put this on the bone behind your ear. I want you to let me know when you do not hear it or feel the vibration anymore.
Okay, I don't hear it anymore. But I do hear it now.
Okay. And same thing on this side.
I don't hear it anymore. I hear it.
Okay. Very good. Excellent job. So everything is intact with your hearing. Let's do some strength testing. So I'm going to have you put your arms out in front of you. Okay. I want you to spread your fingers out. Good. And then don't let me put your fingers together. Good. And I want you to keep your arms out. Don't let me push your arms down. Great. Arms in front of you like this. Push me away. Good. Pull me in towards you. Great. Arms out by your side. Don't let me push them down. Good. And push down against my hands. Great. I want you to push up against my hands. Good. And pull down, push down. Good. Okay. I want you to push me away. Good. And pull me in towards you. Great. And one last one. I want you to press down on your feet like you're pushing on the gas. Good. And up, toes to the ceiling. Great. So your strength is normal, 5 out of 5, equal on all your extremities on both sides,
Okay.
which is excellent. We are going to do a couple more things. I'm going to have you take your right heel, and I want you to take your heel and drag it up to your knee on the opposite leg. Good. And can you do it on the other side? Perfect. Very good. Excellent. You can relax. Okay. Do a couple of funny things. I'm going to have you put your hand out. I want you to close your eyes and tell me what I put in your hand.
A pen.
Good. And other hand, close your eyes. I'm going to draw a number and you tell me what it is.
3.
Very good. Okay. I'm going to do a couple more things to test some sensation. Okay? So this is what you're going to feel. This is dull. Okay?
Okay.
This is sharp.
Okay.
Got it?
Yep.
Okay. I'm going to start with your face. Tell me if you feel sharp or dull.
Dull.
Good.
Sharp.
Good.
Sharp.
Good.
Dull.
Mm-hmm.
Sharp. Dull.
Great. You doing your arms?
Dull.
Good.
Sharp.
And down on your legs?
Dull.
Good.
Sharp.
Good. And one more thing. I want you to tell me if you feel 2 points or 1 point touching you. Okay?
2.
Good.
1.
Great. Leg out.
2.
Great.
1.
Good. Good. So you correctly identified, so your sensation is intact. So that's really good. Okay, I'm going to, I know this seems funny as well, I'm going to have you touch your nose and then touch my finger. Good. And again. Good. Touch your nose, touch my finger. Great. Touch your nose, touch my finger. Good, which is normal, you're able to do that, so that's good. Okay, so I am going to have you stand up, okay? And I'm going to have you just take a few steps and walk towards Jimmy. And come back and walk back. So I'm observing your gait is normal. You're not off balance. You're not feeling dizzy or lightheaded.
No.
Okay, very good. I'm going to have you take a few steps on your tiptoes and then come back to me on your heels. Testing the strength in your lower spine. Good. And also giving us some information on your balance and coordination. So that's really good. Okay. I'm going to have you put your arms out in front of you. I want you to close your eyes and I just want you to stay here for me. Good. So I don't see that your hands are drifting at all. I don't see any swaying. So this is a negative Romberg test. You're not moving at all. You feel okay?
Mm-hmm.
Okay, you can open your eyes. And I want you to put your arms out by your side. Good. And I want you to close your eyes. I'm going to push down on your arms. Okay, just good. And they come back to normal, so that's great. You can relax. Very good. So I'm going to have you have a seat. Okay? And I'm just going to do a couple more things. I'm going to listen to your heart and lungs,
Okay.
just feel for your thyroid, and listen to the arteries in your neck. Okay?
Okay.
Take some nice deep breaths in and out through your mouth. Okay? Relax. Take your time. Great. A couple more. And one more. Very good. So normal vesicular breath sounds heard throughout. You don't look like you're in distress at all, not using your accessory muscles to breathe, no wheezing, no abnormal breath sounds. So that's good. Breathing comfortably?
Yes.
Good. You're not having trouble breathing at nighttime, laying down?
No.
Okay, good. I'm going to listen to your heart. I'm going to listen a few different spots, a few different times. Just relax and breathe normal. Sorry. Okay. I'm going to listen again one more time. Sorry about that.
That's okay.
So normal rate and rhythm, or regular rate and rhythm, I should say. She doesn't have any murmurs, clicks, gallops, or rubs. No abnormal heart sounds at all. I don't have a bell on my stethoscope, so I listened twice, just pressing more firmly to resemble the bell on the stethoscope. So I'm just going to take a look at your neck. Just keep looking straight ahead. I'm going to put my hands on your neck. You said you have a history of hypothyroid. Okay, I want you to swallow for me. Good. Excellent. And I'm going to listen to the arteries in your neck. Now, you never had a stroke before, or a mini stroke, right?
No.
And has anyone in your family had one?
No.
Okay. I'm going to have you turn your head to the wall. I'm going to come near you with my stethoscope. I'm going to have you take a breath and hold it while I listen, okay? Take a breath and hold. And relax and breathe. And I'm going to come to this side. Same thing. Take a breath and hold. And breathe. Very good. Okay. Anything else bothering you today?
No.
No. Okay. I think this is gonna complete the exam. Thank you for being such a great patient.
You're welcome.
Before you go, actually, there's one more thing I want to do. I want to test your reflexes. Okay? We'll do this really quickly and then we'll be done.
Okay.
Okay. So I'm going to just grab your arm here. Just relax your arm for me. Okay. Relax. Good. And I'm going to test the bicep tendon. Okay. And just relax your arm in my hand for the tricep tendon. Good. And same thing on this side. Okay. Very good. And relax your arm in my hand, okay? Okay, good. Relax. And just a couple more. Just the knees, the one that everybody thinks of when we do the reflexes. Just relax, okay? Okay. Good. So normal reflexes, nothing abnormal there. Okay, so I think that's going to conclude our exam. Thank you very much.
Thank you.